Hi and Assalamualaikum everyone. We are from Group 2. We present about tissue and organ transplantation. These are the list of group members for Group 2. This presentation will be divided into 4 parts, which are introduction, definition, discussion and conclusion. Okay, moving on with the first part, introduction. A transplant is an organ, tissue or a group of cells removed from one person and surgically transplant into another person or moved from one side to another side in the same person. Next, why is transplantation needed? Transplantation is necessary because the recipient's organ has failed or has been damaged by disease or injury.
I will continue on why transplantation is necessary. Transplantation is the best method for replacing damaged organs and tissues. Basically, it is the treatment used for the last stage of organ failure and most often provides their only chance for survival. So how does it work? The doctor will examine the patient whether they are a suitable candidate for an organ transplant. Only organs that are able to regenerate or organ whose half number are able to do full work can be used for transplantation, such as kidney, heart, liver, or others. The donor and the recipient may be at the same locations, or organs may be transported from donor site to another location. Okay, unless those who are under 18 that require permission from guardian, anyone can be potential donors. The doctor will then decide whether a person's organs and tissues are suitable for donations. So I'll pass to the next presenter to continue.
The scope of tissue and organ transplantation is covered on 3 phases: pre-transplantation, transplantation, and post-transplantation. In pre-transplantation phase, the transplant recipient will have a pre-transplant evaluation that includes a variety of medical tests to identify potential problems before transplant surgery and avoid potential complications after surgery. The recipient will then be listed on waiting lists until a compatible match of tissue or organs is available for transplantation. The transplantation phase includes organ harvesting, pre-operative procedure in which the recipient will have several tests to evaluate his or her fitness for surgery, and then the transplant surgery will take place. In post-transplantation phase, the recipient will be closely monitored for 2 to 4 weeks to evaluate the success of the procedure. The recipient will be prescribed immunosuppressing medication which suppress the immune system and prevent body from rejecting the new organ.
Alright, now we are going to talk briefly about the history of tissue and also organ transplantation. So basically, researchers has been experimenting with organ transplantation on both human and also animals back in the 18th century. There were so many failures over the years, but it began to succeed in the mid 20th century. So the first ever successful organ transplantation, which was the kidney, was first performed by Dr. Joseph Murray at Brigham and Women's Hospital back in 1954. So as we can see in the slide given, after the first successful kidney transplantation, more organ has been successfully transplanted from one human to another human by different surgeons, and up until now, organ transplantation technology remains as one of the most important technology in medical field.
Okay, after we go through about the timeline and the history of the transplantation of the tissue, let's see about how far the successful rate in the transplantation. For our information, in one journal, about 270,000 of the initial transplant for the kidney transplantation has been performed since 1970. It is the huge number of the recipient. Other than that, we can see about the liver and heart transplantation. Both of them is show that more than 50% of the recipient survive for the 7 years. It means that it is meaningful to the patient and give the strong data for the successful in transplantation. Okay, for the more explanation for the type of transplantation, we can see for the next present. We can see later in the next present.
Types of transplantation: tissue and organ. For tissue, it is still possible after the heart and lungs stop working, and donors do not require ventilator to keep alive, as tissue can be removed within 24 hours after the death. For organ transplant, the donor should be alive, or in other words, donor must be maintained on a ventilator until organs are removed. Types of tissue transplantation are as follows. Cornea, in which one cornea can be donated to two persons. Transplantation of bone matrix, nerve, musculoskeletal tissues, and cartilage help to replace and bridging damaged tissues for functionality recovery of corresponding tissues. Lastly, composite transplantation that involve immunosuppressive therapy to lower body immune system and risk of rejection.
On to the types of organ transplantation, which are kidney, the most common type of transplant surgery, while intestine is the least common. There's also heart, trachea, which is for patients who suffer from hardening and narrowing of their one part. Lung, pancreas, liver, and skin. Skin autografts as temporary cover for wounds or burn until the skin heals, while skin allografts is to cover massive skin loss. Next, generally transplantation can be classified into several categories, which is autograft, transplantation of cells, tissues or organs between sites within the same individual. Allograft, transplantation from a donor to a non-genetically identical individual of the same species. Xenograft, between two different species. For example, pig valves used to replace human default valves. Next, isograft, transplantation between identical twins. And lastly, stem cell transplant.
Let's proceed by discussing about the practices. First of all, hospital call the life source when the criteria are made. Death can be occur one of two ways. Firstly is cardiac death, which is the heart is no longer able to beat by its own. Secondly, the brain death. It is the reversible function loss of the brain. In either case, when the death is declared, the hospital will call the life source and the organ donation will be discussed. The patient is kept on ventilated support and life source will send the family support coordinator to discuss with the family patient about the organ donation. There are few last steps before the organ donation. Firstly is medical evaluation. The life source, hospital staff and the transplant center team will review the state and the function of the organ. The donor is kept on ventilation while all necessary tests and procedures are completed. For surgical recovery and transport, the transplant center will coordinate and manage the process of organ recovery, preservation and transport to the recipient hospital.
So basically there's 11 principles of tissues and organ transplantation mentioned by WHO, but I'm going to focus on 5 important ones. So first, consent required by law is obtained, or there's no reason to believe that the deceased would object such removal, but if the deceased has neither consented to the organ removal, permission should be obtained from legally specified surrogates such as family members. And second, potential donor that has died should not directly involve in cells, tissues or organ transplantation. This is to avoid conflict that would arise that due to the death of the potential donor, it might be responsible of welfare of other patients that are depending on the cells, tissues or organ from that donor. And third, living donors may be genetically, legally or emotionally related to the recipient. So basically donations by unrelated donors may be a source of concern, such as the donors are not immunologically well matched with the recipients. And fourth, cells, tissues and organs should be donated freely with no monetary payment or reward. So purchasing or offering to purchase for transplantation or sale by the net skin of the deceased should be banned. And lastly, all healthcare facilities involved in transplantation is prohibited from receiving any payments that exceeds the justifiable fees for the service rendered. That's all for me. I'll pass to the next presenter.
Principle of biomedical ethics. The first one is respect for autonomy. Transplant team clearly understand that if the principle of autonomy is to be respected, life donors must make the decision to donate voluntarily and without coercion. The second one is the principle of non-maleficence. According to the principle of non-maleficence, there is an obligation not to cause harm to others. Thus, the act of life donor organ donation is a balance of risks and benefits. It's not only cause risk toward the donors. The third one is the principle of beneficence. The principle of beneficence requires us to do good for others, particularly when there is no risk to the benefactor. In the case of life organ donation, the goal of beneficence may take precedence over that of non-maleficence if the likelihood of benefit outweighs the risk. And the last one is the principle of justice. This is more relevant to organ allocation because it calls for a fair, equitable, and appropriate treatment based on what is due to the patient based on his failing health and not influenced by other factors such as usefulness to society, social standing, and others.
Next is the etiquette issues of cadaveric organ donations. Cadaver is a major source of organs as it is the preferred options over life donor. The consent for organ donations after death is given in two ways. First is opting in system, which a person needs to clearly state his intention to donate organs in a document, while the next system is opting out or the presumed consent, which one is deemed consented to donate an organ if he did not clearly state his wish to not donate the organ. As organs are a very scarce resource, a system is needed to allocate them based on three ethical principles. First, utilitarian. An action is considered right if it results in more good than an alternate action. Second, justice, which to ensure equitable access of patients to an organ sharing system. And lastly, autonomy, which when a patient refuses to receive an organ allocated to him, it can be given to the next suitable waiting candidate. The last issue is concerning confidentiality. The entire process of life unrelated or cadaveric organ transplantation should be carried out in strict confidence at all levels of healthcare workers and doctors involved.
One of the main concerns that you might have as a Muslim is that can Muslims receive organs from non-Muslims? The answer is yes. So when an organ is transplanted from a non-Muslim to a Muslim, that organ will become part of the Muslim's body that can be used for the purpose of fulfilling their responsibilities as ordained by Allah subhanahu wa ta'ala. So according to Dr. Yusuf al-Qaradawi, he decreed that the organs of non-Muslims are considered to be Muslim because a person's faith, whether a Muslim or not, does not depend on his organs but his soul. So there are no restrictions for Muslims to benefit from the organs of non-Muslims. But how about the other way around?
Alright, to answer Shasha's question whether or not Muslim can donate organ to non-Muslim, in general, donors cannot indicate who can or cannot receive their organs. Instead, the organ will be transplanted to those who are more suitable and with the biggest chance of success. At the same time, Malaysian non-Muslim are categorized as kafir zimmi. So, kafir zimmi here refers to non-Muslim who pledge their loyalty to the country and hence they must be protected and safe when they are in pain. This includes saving their life through organ transplantation. So going back to the question, in Malaysia, the issue of whether it is permissible or not to donate organ to non-Muslim does not arise because they also should be helped when they are in need. This is mentioned in hadith that the upper hand is better than the lower hand. The upper hand is that of the giver and the lower hand is that of the beggar. Sahih al-Bukhari.
As a conclusion, organ transplantation is a especially useful procedure to replace damaged organs in patients with end-stage organ failure. Since tissues and organ transplantation involve the donor and the recipient, it is crucial to protect the confidentiality of both parties to prevent potential abuse. As a Muslim, we must acknowledge that the rulings of organ transplantation is permissible in Islam. Do you ever know that statistically, as of March 2022, only 1.55% of Malaysians have pledged as organ donors? Hence, today I would like to invite all of you to contribute to our society by pledging to become an organ donor. You can simply scan the QR code to fill the form. But remember, you must discuss with your next of kin because the doctor will ask for their consideration before harvesting your organ once you are deceased. That is all from us. Thank you.